Spine trauma is one of the most commonly missed and most critical area in imaging. So miss a single sign which is subtle, then the consequences can be devastating and symptoms may not reflect the severity. So missed injury can paralyze or lead to death. Imaging guides the management of the spine trauma. So welcome to this video on spine trauma imaging, where we will cover a high yield systematic approach you must know regarding the spine trauma imaging. Why systematic approach is required for the spine trauma injury? So need for the systematic approach is avoid missed injuries, standardize reporting, improve clinician communication and essential for the trauma. Now the imaging modalities in spine injury are X-ray, which is used for screening. This is the X-ray image. CT, it is the primary trauma tool for the bone injury, as we can see in this image, clear visualization of the bone. And the MRI. So MRI is done in the case of suspected soft tissue and spinal cord injury, as we can see in this image. Let's see one by one. So role of the X-ray. It is used as the initial imaging in stable patient. It is also used in resource limited settings and alignment and gross fracture inspection. Standard X-ray views are the AP, lateral and odontoid for the cervical spine. We can see here the AP and lateral view. For thoracic, AP and lateral, and for the lumbar spine also AP and lateral. So let's see the odontoid view. Odontoid view is a specialized X-ray projection focused on clearly visualization of the odontoid process or dens. Here we can see this is the dens and this is denoted by this outline. This is the dens. And the second cervical vertebra, that is the C2, we can see here. This is the C2 and this one is the C1 vertebra. And its articulation with the first vertebra, that is the articulation of dens with the first vertebra. Here we can see. So this is the specialized view for the visualization of dens. It is crucial for detecting fracture or injury to this critical area, especially for visualization of the fracture of this dens, and common in trauma by aligning the lower edge of the upper teeth and the base of the skull to a clear unobstructed view. And this may require the open mouth, where we can see this is the open mouth. So this is the odontoid view, specialized view for the visualization of dens fracture. Now the X-ray ABCS approach for the fracture of spine. So A for the alignment, B for the bone, C for the cartilage or disc, and S for the soft tissue. For alignment of the spine, we can see here there are 4 lines: anterior vertebral line, posterior vertebral line, spinolaminar line and posterior spinous line. So red one is the anterior vertebral line, that is the frontal edges of vertebral bodies and should form a smooth curve, that is the lordosis, which is seen in cervical as well as in lumbar spine. Posterior vertebral line or George's line is formed by the back edges of the vertebral bodies. We can see here that is this brown line is the posterior vertebral line and it should also follow the same curve, and spinolaminar line is the line drawing from the posterior edges of the spinal canal. As we can see in this image, this green line is the spinolaminar line, and posterior spinous line, that is the line drawn from the tip of the spinous processes, and it should be evenly spaced and follow the same curve. So these are the 4 lines for the alignment of the spine. Here we can see this is the image, annotated image, where we can clearly see that this is the anterior, posterior spinolaminar line and the posterior spinous line. Now here we can see in this image there is a disruption in the anterior line. Here we can see that there is disruption in the anterior as well as in the posterior line, where we can see this vertebra C2, C3, 4, 5, C. 6 is retropulsed or displaced posteriorly, and there is also disruption of this green line, that is the spinolaminar line. We can see clearly in this X-ray image, and there is also loss of the cervical lordosis. This way we can compare that we can see the alignment of the spine. In CT scan, we see the Danish 3-column theory, where spine is divided into the 3 column, anterior column, middle column and the posterior column. So anterior column include the anterior longitudinal ligament, this is denoted by the red, annulus, we can see here annulus, and the anterior 2/3 of the vertebral body. So this blue is the vertebral body. Middle column include the posterior 1/3 of the vertebral body, posterior annulus, as well as the posterior longitudinal ligament, which is denoted by this blue line. And the posterior column include the posterior element, that is the pedicle, facet, lamina, spinous processes, and the posterior ligaments. Now the limitations of X-ray. X-ray misses 30 to 50% of the spine injury, and there is poor visualization of the posterior element and no cord or ligament assessment done by X-ray. So in this image we can see that the posterior element is poorly visualized. So spinous processes are poorly visualized and cord and ligamentous assessment cannot be done by X-ray. Now the CT scan. So what is the role of CT in the spine injury imaging? So it is the modality of choice and it is excellent for bony details. So for bone visualization, CT is excellent and it is the modality of choice for trauma, and it is very fast and can be done multiplanar imaging. We can see here there is clear visualization of spine. We can compare that this is the X-ray and this is the CT. So CT shows the better bony detail than the X-ray. Now the CT detects vertebral fracture. We can see here burst fracture, this is the burst fracture, posterior element fracture and canal compromise. So we can see here there is a canal compromise, retropulsion of the fracture fragment, we can see this is the fracture body and this is retropulsed into the spinal canal. We can compare from there. There is a spinal canal narrowing and we can see here in this there is fracture of posterior element. So posterior element fracture can be better visualized in CT than the X-ray. Now the important CT signs. So vertebral body height loss. We can see here in sagittal image there is vertebral body height loss. We can see here. Retropulsion of fragments. This is the retropulsion of fragment. We can see here this is the retropulsed fragment. This is the axial image. Facet dislocation. This arrow, white arrow denotes the facet dislocation and this is the complete disruption. We can see here. We can see here there is facet subluxation in axial image. Now widened interspinous space. This is the black arrow denotes the widened interspinous distance. This is the interspinous distance. We can compare with this above and below. So this is the widened interspinous distance. Limitations of CT. So this is also like X-ray. There is limited cord evaluation and poor ligamentous assessment. In this image, spinal cord is not visualized as well as the ligaments. So poor visualization of ligament or poor assessment of ligament and spinal cord in CT. So these are the limitations of CT. Now the third modality is the MRI. So role of MRI is, it is the gold standard for the soft tissue injury. So it evaluates the cord injury, ligaments and discs. As we can see in this image, this is the spinal cord, these are the intervertebral discs and these are the posterior ligaments, anterior, these are the ligaments. So these are better visualized on MRI. So this is the gold standard for the soft tissue evaluation. Now indications for MRI. So first one is the neurological deficit. Second is the suspected ligament injury, epidural hematoma suspected, and the Shiora, that is the spinal cord injury without radiographic abnormality. That refers to the clinician diagnose the spinal cord dysfunction after trauma despite normal X-ray and CT. So, this is primarily seen in the children, but it is redefined like the Shiona, that is the spinal cord injury without neuroimaging abnormality. For cases with truly normal MRI findings, and it is often due to the immature mobile cervical spine in children causing cord stretching or shearing even without fracture. Now, the MRI sequences used for the evaluation of spine injury, that is the T2 for the cord edema, STAR is the ligamentous injury, and T1 is for the anatomy of spine as well as to evaluate the spinal cord hemorrhage. MRI findings in spine injury. So, cord edema. So, we can see here there is a T2 hyperintensity in cervical cord. This is the cord edema, cord hemorrhage. This is the hemorrhage. We can see in this. This is the SWI image or T2 gradient image. This is the spinal cord or hemorrhage within the spinal canal. Disc herniation. Here we can see this is the disc herniation. Now the ligament disruption. So we can see here there is ligament disruption, that is the ligamentum flavum is completely disrupted at this level, and there is also soft tissue edema, and we can also see that this is the posterior ligament disruption. Now the prognostic findings in MRI. So prognosis can be determined by the MRI. If cord hemorrhage is seen, this suggests that there is poor prognosis. As we can see here, there is T1 image showing the cord hemorrhage. This is the cord hemorrhage, and if there is edema only, then there is better outcome. We can see here that is T2 shows the bright signal intensity. So this is the cord edema, and in T1 bright is the hemorrhage. So this suggests that the poor prognosis. Now the imaging algorithm for the spine injury. First immobilize the patient, then go for the CT if available. If not available, then only go for the X-ray. So first nowadays it is the modality of choice for the imaging of spine trauma, and then do MRI if suspected neurological deficit is there and assess the stability of patient. Now the stable versus unstable spine fracture. So what is stable and what is unstable? So stable fracture is the only one column involved. As I said, anterior, middle and posterior column. So if only one column is involved like anterior or posterior, then it is called the stable type of fracture, and there is no significant displacement or neurological risk. Whereas in unstable fracture, there is involvement of more than two column or especially involvement of the middle column with risk of deformity or neurological injury. So we can see here this one is the anterior column, this is the anterior column, middle column and posterior column. So we can compare here only anterior column is involved in fracture. So anterior wedging can be seen. Here we can see that there is a involvement of all three column. So this is the anterior, middle as well as the posterior. So this is the unstable fracture. Now the take home message is the X-ray is done for the screening of spine injury. CT is the modality of choice for the evaluation of bone and alignment of the spine, whereas the MRI is the gold standard for the evaluation of cord and ligament injury. These are my references. Thank you for watching.